Hi everyone, my name is Gakii Masunga and I am a resident tutor and the community health lead in Lowell House. I am also a graduate student at the Center for Bioethics at Harvard Medical School. I'm here with Dr. Mike Springer. He's an associate professor of systems biology at Harvard Medical School. And Dr. Springer is here today to shed some more light on how the COVID testing here at Harvard works. We are so fortunate that we have access to such frequent testing. However, we want to acknowledge that it's really hard to be in isolation or quarantine. HUHS and all the residential staff want to support you however we can. We've heard from students who are frustrated that they have a positive test result, yet they don't have any symptoms, and so they're wondering why they have to isolate. There's also similar frustration with people who are quarantining because of their friend testing positive, even though the friend doesn't have any symptoms. Dr. Springer, could you please talk to us a bit about how the test works and address some of the questions that the students have brought up?
Yeah, I'd be happy to. They're great questions, and these issues can be quite complicated because there's no perfect answers, but there's what's best for the total public health. So it would be wonderful if the only way you could transmit COVID to another person was if you were first symptomatic. Unfortunately, there are two categories of people that can transmit that do not have symptoms. So the first category is asymptomatic people. We now estimate that somewhere around 20%, maybe even upwards of 30% of people who have COVID and can transmit COVID to other people and get them sick never have symptoms. So unfortunately, you could feel great and still pass it on to someone else. So that's just an unfortunate fact of COVID. The other thing is actually, there are a large number of people that we call pre-symptomatic. So from the time at which your test can first pick up your positive to the average time people first get symptoms is about 2 days. And during that 2 days in which you're not asymptomatic, but you're really technically pre-symptomatic, about 40% of all transmission occurs. So unfortunately, you can get a positive test result, feel great, be like, why do I need to go in? I feel great. Why don't my friends need to go into quarantine? And then 2 days later, you get hit hard. And if you stayed out of isolation, you've probably gotten all your friends sick. And then even unfortunately, even if after 3 days you still feel great, you unfortunately can be one of those asymptomatic people, the 1 in 5 people are asymptomatic, where if you weren't in isolation, you could pass it on to your friends. Now, unfortunately, your friends also have to stay in quarantine because if they were a close contact with you during that time, between your last negative result and your first positive result, if they were a contact in those situations where they could have turned positive, the reason we need them to quarantine is to stop the spread of the virus. Because if we let them go out into the world and they were sick, they could transmit it to multiple other people, which would increase the spread. And I actually want to make a quick side point here at how well these procedures can look. So, we see how bad COVID is spreading. So it's hard for us to understand how well these procedures are working. But we actually have a control for understanding how well everything's working, which is the flu. So in a standard year, at this point in time in the flu season, we would have had about 450,000 people hospitalized for the flu. This year, actually, do you want to guess how many people you think have been hospitalized for the flu this year? You want to take a wild guess?
5,000.
So what I heard last week was 173 compared to 450,000. So masking, social distancing, et cetera, these things really work. Isolation, quarantine, they work to stop the spread of respiratory diseases. So you can just see, given this way we've stopped flu, if we weren't doing this, how bad COVID would be spreading if we weren't taking this seriously. So we really, really, really do need to take it seriously.
Thanks for clarifying that. However, there are still rumors going around about false positives. So could you talk to us a little bit more about how this RT-PCR test process goes?
Yeah, let's first talk about the assay itself. And then when we're done with that, maybe we can come back to your question of, does it always work? Can you always trust the result? Because that's kind of the question of false positive there. It's a very good question. Okay, so you're asking how the assay works. So what is an assay, first of all? So, you have some person over here, and you want to know whether or not they have COVID. So first thing is, we need to get some type of sample from them that we could try to detect whether or not SARS-CoV-2, the virus which causes COVID, if they have that. So you're probably familiar with this if you've been on Harvard campus or part of the testing. You start with a swab, and what that swab does is it collects potential material which could have the virus on it. So at this point in time, you'll have a sample, and that sample either will or won't have coronavirus on it. So it potentially has coronavirus. So the next step then is we need an assay or a technique. So we'll often have here a really, really small number of virus. Even if the person is really sick, the swab is only going to pick up a small amount of virus. But in the end, to detect the virus, we need a lot of virus. So in order to actually get to a lot of virus, we need a molecular assay which is able to amplify rapidly and specifically amplify the virus. And the name of the assay that we use for this is called qPCR, or quantitative polymerase chain reaction. And the way this, and what this is going to do is just convert a very small amount of virus into a large amount of virus. So here, we can have as low as 1 molecule, and here, we can have like 2 to the 20th molecule. So millions or 2 to the 30th, even billions of molecules. So how does this happen? So the way the qPCR reaction works is you start with a single molecule, and then a small piece of DNA binds to that and is able to copy this. So you go from 1 copy to 2 copies. Then it heats up, which causes the 2 pieces to come apart, and then you cool back down. And when you cool back down, primers can actually rebind to both of these molecules. There's a small piece of DNA binds to both of them separately. And then each of these individual molecules will go back through this process again of amplification. So you can start with 1 molecule in the first cycle. So if this is cycles of heating and cooling, in the first cycle, you can start with 1 molecule, then you'll have 2, 4, 8, 16. So you'll rapidly increase the numbers. And so at the end, when you have lots of molecules, then we have a machine which can actually sensitively detect the signal. And that's how the qPCR reaction works.
So now that you've completed the amplification, how do you tell whether there's positive sample or not?
Yeah, so that's a good question. So what we do is we plot out the number of cycles over here. So 1 cycle up to, we run these machines for typically 45 cycles. And then you ask for how much signal there is of amplified viral particles. And so what's going to happen is, if the signal is negative, you won't get any amplification. And if you have a really strong positive, amplify really early on. So those are kind of like the easy situations. But often you're going to have kind of, a zone over here where things are going to amplify for different amounts of time. So the question really comes down to, where do you call something positive versus negative? Do you call anything that amplifies positive, and how high does it need to amplify? And so to answer this, the type of thing we would do is you would take a tube where we would put in like 1 viral particle, and then you would do this, hundreds and hundreds of times, run the assay, and then ask, what is the distribution of CTs given that we put in 1 molecule? And what it turns out is, it's about 36 CTs with some range from maybe 34 to 48 is what we get if we run a single molecule into the assay, and we do that over and over again. You get some type of distribution like this. So what we typically will do then is we'll have a cutoff, and we'll say, given this distribution, anything that's a CT value of, like, let's say 38 or less, we would call that a positive. And anything that's over here, 38 or greater, we would call that a negative.
Great, thank you. So if the cutoff is based on scientific evidence, as you've highlighted, does that mean that if the evidence changes, the cutoff might change?
So yes, as evidence changes, but it's a very deliberative process because, the biggest risk is we make a change which causes rapid spread, and we all see what happens when things spread. It can spread uncontrollably for a period of time, and no one wants to be scaling back and going through lockdowns. what we saw this winter was, devastating. And the hope is that we will not have another wave like that again. And so, we need to be very careful about rolling things back. We're doing our best to try to find evidence, bring it forward, et cetera, but we need to be extremely cautious and careful because we don't want to get this wrong. The consequences of doing this wrong are extraordinary and can be quite bad. So we have to be very careful.
Great. Thanks for your time, Dr. Springer, and for taking the time to clarify this for us.
Excellent. No problem. Happy to talk.